All right, welcome back, beautiful people. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour.
A patient had asked about some of the post-recovery things that are really associated with rhinoplasty, but it can really apply to many different surgeries. I think today what we'll do is we'll kind of answer some of these common questions, some pro tips to sail through it. Because look, we understand, for us, surgery is easy. We perform it and you leave, although the challenge of the surgery may always be there on the day of. But afterwards, it's you, the patient, who is recovering, or a family member, or a loved one. And so sometimes we need that little extra information that can make the entire process easier. I'm going to give you an all-encompassing view on the way I see post-operative rhinoplasty and some other surgeries that this will apply to. And hopefully it works for you as well.
Sounds awesome.
You know, obviously anyone undergoing surgery, listen to your surgeon because they may have slightly different rules or tips or tricks. But I'll try to tell you some of the ones that have worked for me. So
and don't just do anything on your own. If you don't know for certain if it's okay to do something,
yes,
reach out to the consultant, to your surgeon. We've got an app that you can directly reach the doctors. You know, just don't go and do something because it can really affect your results.
Oh, yeah. I've had patients that have taken their own stitches out. I've had patients that have removed splints. I've had patients that have done some crazy things despite the instructions. But when it comes to surgery, it's really important to listen to the surgeon because they have a plan for you.
Agreed.
And they want the best possible outcome. And things can happen when you deviate from that routine. Here is one of the things, what to expect the first week in recovery for different types of surgery. So if we look at separate nose procedures, is it for tip reshaping, full rhinoplasty, septorhinoplasty, or when we're doing turbinate reductions or anything else inside for function to help improve breathing? I would say that if we're performing just a tipplasty, it's probably one of the easiest things that we do. You can do it through a closed or open approach. That means whether there's an incision between the nostrils or they're all hidden within the nose. And the idea is that we're just going to narrow the tip ever so slightly. Okay, maybe we're bringing down a hump ever so slightly. Those are usually some of the easiest recoveries. I still will place a thermoplastic splint on the outside to try to inhibit swelling from occurring, right? But once you get to an open rhinoplasty where we're really, let's say someone comes in with a very twisted nose or we're really doing a lot of work, I prefer the open approach because I can see the infrastructure of the nose, completely correct it to the way I want it, and then we simply close the skin, and that scar should heal to the point where it's imperceptible, okay? And if it's not imperceptible, then we can talk about lasering or necessarily revising or doing whatever we need to do to make it so. But when we start adding some of the internal work, so septoplasty, turbinate reduction. So turbinates, for anyone who doesn't know out there, they're little outpouchings on the inside of the nose. They humidify and heat the air. They're the reason why you don't get a brain freeze when you're skiing in Aspen every time you breathe through your nose. But the idea is sometimes those turbinates can get very large, and that obstructs an airway. And even if you have a large nose and you have no obstruction, if we're making it a small, cute nose, we have to make the inside bigger, right? Because otherwise you're not going to be able to breathe at all. What usually happens once we do any internal work, at least what I do, is I will add silicone or silastic splints on the inside of the nose. And they essentially are stitched through the septal remnant or the septum that's left over, and they have tubes in them so you can breathe. Now, it depends how you're trained. Many ENTs, they love packing the nose, and it's great for eliminating any dead space. But the idea is that sometimes it's a little uncomfortable or a lot uncomfortable when you're removing that packing at 1 week. You're sore, you're swollen, you feel miserable because you haven't been able to breathe at all for a certain period of time. And so I tend to think that the silastics or silicone splints are more comfortable for patients. It allows you to breathe. And you still have to keep the area clean, and you still can run into some complications with not fully packing the nose. But I think most of the complications are reduced by placing those. What you will feel afterwards is likely more pressure. If you have a severely deviated septum, what to expect in your post-op recovery, sometimes people they complain because their teeth hurt. their upper teeth. And the reason for that is because you have to imagine the floor of the nose is the roof of the mouth, and they have very similar innervation. So the nerve supply is the same. So the moral of the story is if you're going to have a lot of internal work versus just a tipplasty, your recovery will be slightly more involved than just a simple tipplasty. So, if there's a lot of bony manipulation, you're going to have some bruising around the eyes. You may have that. So these are all things to consider. So my recommendations, 2 days prior to surgery, start arnica, little tabs that go under your tongue, and they reduce bruising and swelling, and then bromelain. You can either eat pineapple, especially the core of the pineapple. You can blend up a smoothie with ice and water, or you take the supplements because that will help reduce bruising and swelling as well. So start 2 days before, take it 1 day before, and every day of the week of surgery, and that will really help reduce bruising and swelling. Helpful tips to be more comfortable when sleeping on your back. Now, when we say that we want you to sleep with your head elevated, that does not mean that you sleep sitting up. No one's going to fall asleep sitting up. It's honestly one of the most miserable things in the world. And to me, not being able to sleep is much worse than having pain or discomfort. So I want you to visualize sleeping in a lazy boy chair that's been kicked all the way back. Your head's above heart level. If you want a particular degree, sometimes we say 30 degrees. You do not have to sleep at 60 degrees. I mean, again, sleeping upright is never a fun thing. Other things that I would recommend is put a foam wedge behind your back, or an airplane travel neck pillow, or a weighted blanket. Pillows all the way around the body and under the knees, because when your body's in that ergonomic lazy boy position, believe it or not, it's so comfortable, and it alleviates some of the stress on the lower back. Sometimes what I say is if you're having difficulty sleeping, because I tend to give my patients a steroid pack afterwards to really force the reduction of swelling. And sometimes it makes you a little jittery. And so I would say you can take Benadryl. So that is 25 milligrams every evening as necessary. And if that doesn't work, go ahead and double it up. I know that they say 25 is their recommended dose, but you can double it up to 50 and it's completely safe and healthy. And then, you're going to have a bedtime ritual that week. You are essentially want to make sure that you're in a calming atmosphere. And I know everybody wants to prop themselves up in bed and just watch TV. Do that during the day, but at night, try to avoid doing that. Sometimes it's hard for the brain to shut off, especially post-surgical. And so you want to get into that nighttime routine. I often recommend, as you're laying there, kind of going through a guided meditation. And most of the time that kind of resets and lowers the thought process and really gets you ready for bed.
What about what to eat? Is there so somebody has rhinoplasty? Because again, when I do breast surgery, it doesn't matter. I mean, you tell people not to eat spicy foods after anesthesia for the day.
Sure.
But generally speaking, you do the breast aug, they go home, they're like, oh, that felt like nothing. Thanks, have a nice day.
Yep.
With rhinoplasty, it's very different. What should they eat?
I usually recommend a blander diet, at least a low salt diet. Here's the thing, for the first week, obviously, you're not going to have alcohol. You're not going to have coffee, things like that. I know many of you coffee drinkers are groaning right now, but the idea is coffee has caffeine. Same thing with tea, has theophylline. And what it does is it temporarily increases blood pressure. The last thing you need is for a tiny little clot to blow off of a little vein or artery, and all of a sudden you've got a whole different ball game here. And so avoid those things the first week. But a low salt diet, again, salt causes swelling. That's why the real combo is this. You go eat at a fast food restaurant full of salt. Then after you've had multiple drinks, anyone out there knows that it's hard to get your ring off. Your feet are swollen.
Can't open your eyes.
Are swollen. So imagine what's going to happen to an area that's already inflamed and full of edema or tissue swelling.
So keep it simple, guys. Bland diets. Yep. I tell people, even it's going to be even hard to chew. This is the one thing that I've heard Dr. Layke say to people. It feels weird because your teeth are sensitive. So don't go get yourself a steak to eat the first night. Okay?
You're not eating an apple.
Smoothies, things are very simple. I don't think most people that have rhinoplasties should have this big appetite after anyway. So, but that's really in a nutshell what it comes down to.
Yeah, I would stick to softer foods. It's applesauce, mashed potatoes, bananas. And then you can have soups and pastas, things like that. And then as you feel more comfortable, and I don't recommend drinking out of a straw. Even if you have a smoothie, I recommend a spoon, because imagine, just purse your lips as you pretend you're drinking from a straw. Imagine that you're pulling against the nose. It's not going to feel very good. And sometimes you have to pull, especially for a smoothie, you got to pull strongly. And so I would say still eat with a spoon. It just makes it easier on you.
Now, what about somebody who's gotten migraines? This is something that I'm kind of questionable about, because I get this question sometimes.
Yes.
I have migraines, just had a rhinoplasty. You just broke my nose literally and put the bones back together. The only thing that fixes my migraines is aspirin. I need to take aspirin.
Yeah.
Or Advil.
This is one of those really difficult things, because, it can be disastrous in a facelift. I remember one of our colleagues, she performed a face and neck lift. Yeah. The patient had migraines, went to the ER, and they loaded her up with,
caffeine and aspirin.
They gave her these migraine medicines that ultimately are like, taking ibuprofen, and they affect your platelets. So she bled, bruised, and it ultimately affected the results. You cannot take these things. So the idea is get comfortable with taking 1,000 milligrams of Tylenol or your pain medicine to help quell that. And then use some of the other techniques, rubbing the temples and the back of the head. So have a family member give you that head massage. The idea is ice compresses, anything to help reduce some of the inflammation. Turn down the lights, lay down, because all it takes is one aspirin or ibuprofen, and your post-op recovery just changed to a complex one. And so, but this is a very important point that you just hammered home here. So I think one of the other things that I think is really important coming out of surgery is that many people get post-surgery blues. Sometimes this is a combination of the narcotics you've received from surgery, the pain, the discomfort, the pressure, and it's really interesting because some people have depression. Some people
I have the opposite after breast augmentation.
Yeah.
They're very happy.
Very true.
No, but it's very true. Think about if you have to sit at home with a cast on your nose, feeling stuffy, and you don't get to see what it looks like. And then once you even take it off, it's swollen. You're like, oh, what did I do to myself?
Yeah,
because you have to be patient after surgery like this.
You look in the mirror, and on post-op day 2 or 3, your eyes are swollen, and you said, what have I just done? Yeah. And you've got guilt and regret, anxiety, mood swings, all of these different things. You're irritable because you just don't feel well. And so you take it out on family. And this is all normal after surgery, especially for the first few weeks. And it can be disorienting to see a new face in front of the mirror. Now, when you're 16, you've only had your true adult nose just for a couple of years. It's much easier to switch over. So when that cast comes off and you see it, and oh my goodness, it looks beautiful. You have this done at 40, and it will take you a good week to 2 weeks for you to become adjusted to the nose. Doesn't matter if it's absolutely gorgeous, because there are some changes you're not used to. Especially, I see this a lot with patients who, let's say they have a drooping tip, and you raise it, even it's to the perfect, beautiful angle, they immediately think, oh my gosh, it's upturned a little bit. Now, you have to understand that the tip is going to drop a little bit. And so the idea is it'll settle. So you can find this, patients are talking about this all over the place. Reddit, TikTok, YouTube, they all talk about how the fact that when the splint first comes off, yes, it's beautiful, but it might be a little upturned. It's going to settle ever so slightly, just because imagine a half-filled balloon. Now you fill it up, that's the swelling. What happens? It raises up. And then as the swelling goes down, it tends to shift into its eventual position. And so whatever issues you have, you should have an open and direct line of communication with your surgeon. You're going to figure out right off the bat when you have your consultation on whether that's going to be possible. Some surgeons feel that you should be separated from them. And so What that means is that they perform an operation. They are the expert, and so they know, what's best for you. But you'll know right in the consultation because they should be listening to your input, your inspo photos, and what your ultimate outcomes are. Now, if what you're saying is different from the photos that what you're showing, you see this in breast surgery all the time. They'll say, listen, I want to look natural. And then they'll show you pictures of someone who's got double Ds. Again, we have to come to the realization everybody lands on the same page. That's why I use the Vectra simulator, because I show them what I think the goal should be. And they either like it or they don't.
Yes.
This is
which is important, because you need to be on the same page, because if you're not, it's going to be a real disaster.
Oh man. Listen, I always say the same thing. Every surgeon has their own aesthetic, especially when it comes to noses. You've seen Instagram and with these upturned, pinched, although they can look great on certain individuals, for the general public, it's not going to stand the test of time. Right. And so you'll get an idea looking at some of the before and afters, which will really show you whether or not it looks natural or if some people want that overdone look. I tend to prefer the natural look, and so I create that in the simulation. Now, I always say the same thing. If you see what I create and you don't like it, run, right, because that's what looks good to me.
Now, the first week's always difficult, but what about, the next 5 weeks leading up to, because normally what we say is at 6 weeks, we're going to let you do just about everything. What about those next 5 weeks for people that are very active, that you don't want them to exercise? For people who, there's a lot of things that people think that they're just going to go right back to real life, but it's not like that, because you just had major surgery, and we want to make sure that it heals okay.
Yeah.
And we want to keep your sanity as well.
Yeah. I always say the same thing. At 2 weeks, it's okay for you to gently blow your nose. Gently. This is not a farmer blow. This is gently blow your nose. Okay. I think that at 4 weeks, it's okay to wear glasses, sunglasses, and exercise. Now, depending on the level of work, if I can get you into exercising a little earlier, I will. But the reason for that, again, the last thing you want is to do strenuous exercise, get your heart rate up, and it pops off a little clot, and then you bleed, and your beautiful nose now has been affected, or you have to go back to surgery to drain a hematoma. So, and then at that point, at 6 weeks, you're pretty much event ready. It's not the final appearance, but 70% of the swelling's gone, and so you should look pretty good. People with thick nose, thick skin, that's going to be closer to 3 to 6 months, before you start really seeing the light at the end of the tunnel. I think that in those 5 weeks, one thing that's really helped for me is I use the Mirror Me 3D platform. These are clear acrylic custom-made splints, using the simulation that we created on the Vectra, and essentially molds your nose into its new shape and position. And so to me, it prevents swelling and even can help mold the nose, squeeze out some of that tissue fluid. So honestly, it's worked well in my practice.
And it looks aerodynamic.
Yeah. It's clear acrylic. It's like adjustable trays for the teeth. Totally. So you can take it on and off and stuff like that. Things to remember, I think red light therapy will help with anxiety, depression, and inflammation. So that's always a great thing. Hyperbarics is wonderful for post-rhinoplasty. Sometimes it's a little difficult to lay flat, and so you just ask them for an extra pillow, but that hyperbarics will really help with swelling, especially those with very thick skin. You can use your ice roller to calm your system, and so for many people, they have those little rollers. You stick it in the freezer, and then you bring it out and roll your forehead and your face, and that'll help with lymphatic drainage, and so that's always great. And then get outside, sit in the morning sunshine. Even if you've got a hat on, get out there,
go for a walk.
Yeah. Listen, I think, if you want to wear a hoodie and just kind of walk up and down the block, we're not saying go for an hour-long hike, but the idea is just to get the blood pumping a little bit and make you feel like you're not in prison. And then drink plenty of water, flush the anesthesia out of the body. Again, avoid processed sugars, salts, things like that. Take a probiotic, because some of the narcotics are really going to affect your system as well as antibiotics. And then you take your vitamins. Take your vitamin D3, your K2, your B complexes, and even a B12 in there is always a great thing.
You want to do everything you can to make yourself heal better. So, I would just eat clean, get as much sleep as you can, And like you said, you got to put yourself in a good mental frame. Try to make yourself not anxious. And again, it's easier said than done. However, if you can actually get these things ready, knowing that it's coming up to surgery time and making sure that there aren't going to be any stressors. Life is life, and sometimes you can't avoid it. But if you can make it so you can have the best chance of healing well, then I think that's the way to do it.
Definitely.
And again, each surgeon is going to have a different, 15 points of how to recover from rhinoplasty or from any surgery, but they're all generally the same.
Yeah, listen, the principles are the same.
Yes.
Here's what I would say for any of you that are undergoing rhinoplasty or considering undergoing rhinoplasty. I would be very concerned if you didn't have a detailed preoperative plan for post-op recovery. Because the idea is you want the surgeon making you aware of what's necessary to achieve the best possible result.
It's actually really important what he just said, because it's one of the procedures that have the highest revision rates. It's not because the surgeons are all bad. Okay, that's probably a part of it, but realistically, it's because that something went wrong in the recovery period, or you didn't follow all of your post-operative protocols, or you got back to activity too quickly. It's gotta heal. Imagine everything's millimeters with the nose, unlike a breast surgery or even a facelift. This is very different. If something heals a little off with your lower lateral cartilage on the right side versus your left side, your nose is going to look completely off. So stick to the post-operative regimen, 6 weeks, even 3 months, just to make sure it's perfect so you don't have to worry about it and get it done again.
More exciting episodes just like this. Watch here now.
When they tell people that they're having a breast reduction, people are like, what are you, crazy? People go and get breast augmentations. Why are you making your breasts smaller? And I've heard this so many times from the lay person out there, and it's a really uneducated thing to say.